Hello, good morning, and welcome to our Padlet. So my name is Hayley Martin, and I am the Macmillan Personalised Care and Support Facilitator at Medway Hospital. And I'm really pleased to be joined today by Jo Brown from the Macmillan Welfare and Benefits team. Jo, would you like to start by briefly introducing yourself?
Yeah, so my name is Jo Brown. I am the Macmillan Operations Manager for the Medway North and West Kent Macmillan Welfare Benefits Service. So I manage a team of 7.
Wow.
I was just going to say we work out of we work out of Medway Council, but it is a partnership with Macmillan.
Fantastic. Brilliant. Well, thanks, Jo. So today we're going to run through some of the most common questions that people ask about the support that your team can provide. And hopefully this will help anybody watching understand how you can help them and how to obviously get in touch with you if they need support from you and your team. So to start with, can you tell us which areas you cover?
So we recently extended the areas that we cover. So we cover Medway and North and West Kent. Now that area covers Maidstone, Dartford, Gravesham, Sevenoaks, Tunbridge and Royal Tunbridge Wells, and the outlying areas. So it's a big area that we cover. What we don't cover is we cover Sittingbourne and Swell area.
Okay, brilliant. Thank you. And can you help people? So can you tell us how can you help people affected by cancer? What sort of things do you deal with?
So we deal with welfare benefits and financial advice. So one of the things that is a common question that we have is, I've got to take some time off work or something like that, and how am I going to afford to pay the mortgage? How am I going to afford to feed the kids? So we will talk to people about finances, any replacement benefits that they might be entitled to. We'll signpost them on if we think that they might need some additional help support elsewhere. But on the whole, we talk to them about their money and their savings, those sorts of things, to see how we can help.
Fantastic. Brilliant. Thanks, Jo. So some people might feel that they're not eligible because of their circumstances. For example, still at work, or they feel they might have too much income or savings. So does that mean that they can't get help from you and your team?
No, not at all. There are some welfare benefits that are not reliant. They're not means tested. They're not taxable. You can get them even if you are still working. So I'm talking about things like personal independence payments or attendance allowance for older people. So those benefits are payable based on how whatever your diagnosis is affecting you, things like personal care or mobility. So we will look at that, talk to you about that, and we will see whether we feel that you meet the criteria for those, regardless of your income or your savings.
Brilliant. Thank you. So another question that we often hear is if somebody gets the all clear or finishes their treatment, are you still able to support those patients, or would they lose any support from you that they've already sort of got and secured?
So what we do is we work with our clients until our patients until we manage to get the outcome that they need. If there's been a change in circumstances and possibly they are going to return to work, we can give them the advice prior to that. We can do things like better off calculations, so we can see whether there are still things that they can claim whilst they're working, and we'll continue for some time until we make sure that everything is okay. We won't necessarily then go on from there. So if we think that you have gone through, you've gone back to work, you know things are back on an even keel for you, then we would close your case.
Okay, that makes sense. Brilliant, thank you. Okay, and what about those patients who potentially don't need support right now but might need some help in the future? Are they able to reach out to you at any point in their journey?
They are, yes. So they could speak to one of the hospital staff felt that the physician and they weren't had a referral, or they weren't ready to speak to us. But also they can make a self-referral. So they can go on to the medway.gov.uk site and they can do a self-referral that will come straight through to us, and we can talk to them and see what sort of support that they might need at that point. And we'll give them our phone number so they can always give us a call.
Amazing. That actually does cover a bit of my next question, which was, how does somebody actually get referred to your team? So I think I heard there it either can be a referral via their clinical nurse specialist team, or referral via your website. Is that correct? Is there anything I'm missing?
It is. No. So that you can get support from, as I said, from the clinical support team, from doctors, from GPs. If you ask them to do a referral to us, they can do that directly, or you can go on to the medway.gov.uk site and you can refer yourself. You could ring up and see how you do it if you know, if you're not sure. Most of our referrals come from clinical nurse specialists.
Yep.
And they will talk to the patients, sort of asking if they want and giving their consent to refer to us. So if anybody hasn't had that discussion, then maybe they could ask their CNS and see whether they feel it's appropriate as well.
Brilliant. Lovely. Thank you. What can a patient expect? So once they have sort of reached out to you, either self-referral or via their CNS team, what can they expect to happen next in the process?
What we will do is we will give them a phone call in the first instance. It could be a phone call to the patient directly, or if they have suggested that they have a preferred contact, could be, you know, a partner, a carer, son, daughter. Then we will contact the preferred contact.
Okay.
And we will go through a sort of series of questions just in that first call. So we might be asking things about what income you have already, what sort of savings that you have. We might ask about your personal circumstances, who else is in the property, because that all has an impact on welfare benefits.
Yeah.
So we'd ask those questions first. Now, if it's somebody who has been diagnosed as seriously ill or with a limited, you know, a prognosis, those cases are looked at within 5 working days, and we'll make the applications for within that time, so that there is no time lost. If we have a bit longer time, you know, the patient might still be working, there might be other things to do, those cases will go to an advisor who is very experienced in looking at all benefits, not just disability benefits, but we'll look at universal credit, we'll look at everything, actually, all benefits we cover. And they will work with that person until we get the desired outcome. We do appeals with, you know, the DWP as well. We'll ask them to look at claims again. So we do a lot of complex casework for people to hope to take that strain of dealing with it themselves when they don't really feel like it.
Yeah, brilliant. That sounds really supportive. Great service there. So obviously you've said how you support the patient. If I'm asking about loved ones, for example, a partner, friend, a carer potentially who has cancer, can you support them as well?
Yes. So we will look at the household or the family unit if that's what is required. So quite often somebody who, when they first come to us, might still be working, but then when they've gone through their treatment, they might become unwell. Their partner might need to go part-time or give up work to care for them. So we work with them that entire time. So we will look at the differences, how they might be able to replace some income for a carer's allowance, that type of thing. The same with sons and daughters. You know, sometimes they're sort of caring for their parents when they're going through a patch like that. So the partners or the carers behind and work with them.
Really helpful. Obviously the carers do sort of go through it as well as patients. So it's really good to hear that you take that holistic approach. One last question for you, Jo, if that's okay. And I know that this can potentially be quite a difficult one, but if somebody sadly dies, if they pass away, can you still help their surviving partner or family members?
Yeah, so we do. So what we do is we will initially we'll send a letter once we hear that somebody has, as you say, sadly passed away. We will send a letter saying to the surviving partner or carer, if there's anything that you need or you want to come back to us. We appreciate that that's a time of, you know, a lot of things going on and lots of arrangements to be made. We'll give advice over the phone about calling the DWP, and then we would give them some advice as to what their next steps might be.
Okay.
It could be, you know, that they return to work. It could be that they're not in a position or are not willing to or not able to go to work again to that time. They might be retired, they might be lonely. So we'll look at all of those sorts of things to see whether we can either signpost them or we can look at what they're getting, because the problem then is that the income has reduced dramatically.
Yeah, absolutely. Okay, thank you for answering that important question, and thanks for answering all the questions so clearly. Hopefully this video has really supported patients in understanding a little bit more about your service, how they can refer in and get support. As we've rightly said, if they do want to refer in, they can reach out to the CNS team or refer by your website, and there are contact details on this Padlet, but also on the Medway Council website as well. Any final remarks, Jo, before we sign off this video?
I think, you know, just don't be afraid to ask. That's sort of my advice. You know, worst case scenario, we're just going to tell you, even if you're not entitled to something, we will be honest with you, but you possibly are. So just ask, and we're happy to talk to you.
Amazing, brilliant. Thank you very much indeed, and thanks for watching, everybody. We hope you found the video informative and helpful. Take care. Thank you.